A prior authorization reform bill reaches a key milestone. The Medicare Board of Trustees releases their annual report. And congressional Republicans consider a third budget reconciliation bill. For the week of June 15th, 2026, from Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
So now we're proceeding. Our first order of business today, is consideration of the Labor, Health, and Human Services Education-Related Agencies Appropriations Bill for fiscal year 2027. I'll now recognize...
Kicking off this week's episode with news from Capitol Hill, where the House Appropriations Committee favorably reported the fiscal year 2027 Labor, Health, and Human Services spending bill to the full House of Representatives by a party line vote of 34 to 28 on Tuesday, following a 12-hour markup. Under the legislation, the U.S. Department of Health and Human Services would receive $110.8 billion in total funding, a 4% or roughly $4 billion cut. The National Institutes of Health would receive a $100 million funding increase, with targeted increases directed toward cancer research, Alzheimer's disease, ALS, diabetes, women's health, and rare diseases. The Centers for Disease Control and Prevention would see a $1 billion cut under the bill. There would be no direct appropriations changes for the Centers for Medicare and Medicaid Services. The package reduces funding for the Health Resources and Services Administration by $873 million, while the Agency for Healthcare Research and Quality and the Patient-Centered Outcomes Research Institute, or PCORI, would be eliminated entirely. Funding for the Substance Abuse and Mental Health Services Administration would be reduced by $145.3 million. Similar to last year, the manager's amendment adopted by appropriators would prohibit HHS from spending funds on the Wasteful and Inappropriate Service Reduction, or WISR model, or any other model that would employ prior authorization in the traditional Medicare program. It also includes a request for a report from CMS on the impact of WISR and how states were selected for participation in the model. The package also specifies that funds cannot be spent on administering federal student aid programs in a manner that does not designate advanced nursing programs as professional degree programs. This provision is in response to a recent rule finalized from the Department of Education implementing new caps on borrowing limits for graduate and professional degree programs, as established by the One Big Beautiful Bill Act. The rule excluded certain graduate-level clinical programs such as nursing, physician assistant, occupational therapy, and physical therapy from the definition of professional degree. During the markup, the committee adopted a bipartisan amendment expressing concerns about delays in the availability of NIH grants. The amendment highlights that as of June 2026, the amount of available competitive NIH awards is down 48%, and the value of all competitive awards is down 40% in fiscal year 2026 as compared to fiscal year 2024. In related news, Senate Appropriations Committee Chair Susan Collins, a Republican from Maine, decided against marking up any fiscal year 2027 spending bills last week. Appropriators in the Senate have yet to reach an agreement on top-line defense and non-defense spending levels for the next fiscal year, and Democrats have said they are withholding their support for individual appropriations bills in the absence of such an agreement. Commerce, Justice, Science, Agriculture, Food and Drug Administration, Legislative Branch, Military Construction, Veterans Affairs, Interior Environment, and Financial Services General Government were the measures slated for possible consideration earlier this month.
A few moments ago, the House Republicans voted to end the Democrat Department of Homeland Security shutdown once and for all. And we are pleased to tell you that we'll be funding for the next 3 years our border security and immigration enforcement. These are critical agencies and critical functions of the
On
federal
Tuesday,
government to state
Republicans in the
obvious.
House of Representatives passed a $70 billion budget reconciliation package to fund immigration and customs enforcement and Border Patrol for 3 years. The bill, which contains no health care provisions, has been signed into law by the president. The GOP is now turning its focus to what could be the third reconciliation bill of the second Trump administration. The president himself has called for a third reconciliation bill to provide $350 million in funding for defense, while Senate Finance Committee Chair Mike Crapo, a Republican from Idaho, has suggested the inclusion of health care entitlement reforms that do not impact access to care as an option for inclusion in a third package. The House Republican Study Committee has begun holding meetings about deficit reduction options that could be included in the next bill, with addressing fraud in Medicare, Medicaid, and other safety net programs, along with the funding of cost-sharing reduction payments for insurers reportedly under consideration. Other Republicans have expressed caution about the inclusion of additional health care provisions in a new reconciliation bill, with Energy and Commerce Subcommittee on Health Chairman Morgan Griffith, a Republican from Virginia, asserting that any health care changes should be small to allow systems, quote, to adjust to the changes we've already made, unquote. Several senators, including Senate Appropriations Defense Subcommittee Chairman Mitch McConnell, a Republican from Kentucky, have expressed reservations about a third reconciliation bill, with McConnell stating at a hearing this week that he thinks it's, quote, safe to conclude there will not be another reconciliation bill, unquote. The Improving Seniors' Timely Access to Care Act has hit 290 co-sponsors in the U.S. House of Representatives. The milestone allows a motion to be filed to place the bill on the House consensus calendar, giving the primary committee of jurisdiction 25 days to advance the legislation before the bill is moved to the consensus calendar for a vote on the floor. The bipartisan legislation introduced by Representatives Mike Kelly, a Republican from Pennsylvania, and Susan DelBene, a Democrat from Washington, aims to improve the Medicare Advantage prior authorization process for certain treatments and tests. Companion legislation in the Senate, sponsored by Roger Marshall, a Republican physician from Kansas, and Mark Warner, a Democrat from Virginia, has been introduced and currently has 70 co-sponsors. Shifting to news from the administration today, where the Food and Drug Administration has approved a new sunscreen ingredient for the first time in 20 years. Bimetrizanol is the first new active ingredient added to the over-the-counter sunscreen monograph since the late 1990s. It's been marketed as a sunscreen ingredient in Europe and other countries for decades. The ingredient provides protection against both ultraviolet A and B rays and has low levels of absorption through the skin into the body. It's been generally recognized as safe and effective for use in sunscreen by adults and children 6 months of age and older. A federal judge has blocked the Trump administration's attempt to raise the one-time fee for new H-1B visa applications to $100,000. U.S. District Judge Richard Stearns ruled that the proposal, stemming from a September 2025 presidential proclamation, violates the Constitution's separation of powers, characterizing the policy as an unauthorized tax that requires congressional approval. H-1B work visas are used and typically paid for by employers looking to hire international workers for specialty jobs. H-1B visa holders are lawfully admitted to the U.S. but are not lawful permanent residents. The Trump administration was sued by 20 states, citing the impact of the proposed fee on their ability to hire workers at public institutions like hospitals. Final news today, where the Medicare Board of Trustees has released its latest forecast of when funding for the Medicare program will run dry. According to the board's annual report, the Hospital Insurance Trust Fund will run out in the second quarter of 2033, a quarter earlier than last year's projection. The change is due to a number of factors, including higher use of medical services and lower income tax revenue on Social Security benefits due to changes established by the One Big Beautiful Bill Act. The trustees wrote, quote, "The projections in this year's report continue to demonstrate the need for timely and effective action to address Medicare's remaining financial challenges, including the hospital insurance trust fund's projected depletion, this fund's long-range financial imbalance, and the rapid growth in Medicare expenditures." Unquote.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with a call to order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Wednesday, June 17th at 10 a.m., the Senate Health, Education, Labor, and Pensions, or HELP Committee, holds an executive session to consider multiple health-related bills. And last, on Wednesday, June 17th at 3:30 p.m., the Senate Special Committee on Aging convenes a hearing titled, "Counting the Cost: Communist China's Toll on Older Americans' Health, Finances, and Security." Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.